If you get pain in the bottom of your heel, then this video is for you. Hi, for those of you who are new to my channel, welcome. My name is Matty and I'm a physiotherapist, personal trainer and fitness enthusiast. In this video, we will be talking about exactly what plantar fasciitis is, how you should modify your daily activities, a controversial but effective treatment for instant pain relief, as well as some exercises that you can do to resolve the issue. And if you watch this video the whole way through, I can promise you that you will see improvements in your plantar fasciitis over some time. Okay, so what is plantar fasciitis? Well, firstly, we're going to talk about the plantar fascia. The plantar fascia is a thick band of fibrous tissue, and it runs across the bottom of your foot as it connects your heel to your toes. Now, plantar fasciitis is a common condition. It causes pain in the bottom of the heel and foot, and it's typically due to inflammation. However, this is not always the case, because if the issue has persisted over 6 months, we would classify this as a more chronic case of plantar fasciitis or plantar fasciosis, as it's more likely that the plantar fascia is degenerative, right? It's your body's forgotten about the plantar fascia, and that's why it's not getting better. So what causes plantar fasciitis? Well, normally it's multifactorial, and it happens gradually over time. It is thought that repeated stress and overuse of the foot can lead to small micro tears in the plantar fascia, which causes inflammation and pain. It is often linked to an increase in unaccustomed activity, i.e. too much too soon. For example, increase in running mileage, the number of steps you do in a day, the time you spend on your feet, and improper fitting shoes. There are some risk factors that can increase the likelihood of you developing plantar fasciitis. These include being overweight, having tight or weak calf muscles, having flat feet or high arches. So let's talk about some symptoms. The main symptom would be heel pain, and this is normally the first thing in the morning, especially after you take the first couple of steps after getting out of bed, or after long periods of sitting. Most people often describe the pain as sharp, and it's normally centered around the heel or the arch of the foot. The pain tends to lessen after walking for a couple of minutes, but can return after long periods of activity. So how does this all get diagnosed? Well, the healthcare provider will usually do a physical exam. So a healthcare provider could be the GP, could be a physiotherapist, and they'll focus on the areas of tenderness in the heel or in the foot. They'll do some tests to rule out anything else. In some cases, they might do an X-ray or an ultrasound to rule out any other conditions, or they might do an MRI scan. Obviously, a prevention is better than the cure, but if you're watching this video, it means you probably already have plantar fasciitis. So let's crack on with the treatment. The first thing that you want to do is offload from your feet. We call it offloading, and it's essentially, I'm just going to really simplify it for you guys. If you're walking 10,000 steps a day, then you want to half it and go down to 5,000 steps. Obviously, this is not forever. You're going to build back into it, but we need to give the foot a chance to recover. You obviously can't completely rest your foot because you have to walk on it. Reducing the number of steps or the amount of activity that you do on your feet is going to help reduce the pain as well. If you run or do any high impact sports like basketball, tennis, gymnastics, volleyball, I would strongly advise that you ease off them or even completely stop doing them for the moment. Usually we find that plantar fasciitis is linked with calf problems, i.e. tight or weak calves. So one thing we can do to provide some relief for the plantar fascia is to actually do some self-massage on the calf, so actual self-massage on the calf, or you can use a foam roller. We can simply place our calf. You don't want to go too low because that will be more on the Achilles tendon. You want to stay on this fleshy part here, the gastroc, and obviously the soleus is underneath. So just gently roll back and forth, really slow. You can go as hard or as soft as you want. You can put more pressure, or you can even add your other foot on to try and foam roll it. And just try that 2 to 3 minutes every day, maybe before you go to bed. That's the first thing you can do. You might also want to try some calf stretches, 20 to 30 seconds, 2 to 3 sets every day. The last bit of treatment I want to show you guys. This is a bit more controversial, and a lot of osteopaths use it. Physios don't tend to use it as much, and it's instrument assisted soft tissue release using a Graston blade or gua sha blade. So you can get these online, maybe like £5-10 for a stainless steel one or a jade one. And then you want to get some lotion. And if you don't want to pay £5-10, you can use a butter knife or a spoon. Same sort of thing, a blunt instrument. You want some moisturising lotion, paper towel, And what you want to do, don't need anything fancy for the moisturiser lotion. What you want to then do, if you can see my foot, this is a bit awkward. I will invest in a proper setup when YouTube starts paying me properly. But you're just going to apply a bit of moisturiser there. Whoa. Let's just sit a bit more. Okay. So, we've got a foot. This is so awkward. Okay, so you spread some moisturiser over. Next thing you want to do is, and you can go as hard or as soft as you want, but you want to kind of first warm up the area by going a little bit lighter. 45-degree angle. Don't do it like this. That's perfect. Put a stretch on the plantar fascia. And this is not for the faint of heart. It's not nice, right? It's not like painful. But I don't know if you can hear the sound, but it's like a grinding sound. Yeah, it's not. Can you hear that? Ooh. And you want to kind of ease into it. And this will provide some instant relief from the heel pain that you get. And the research isn't amazing for this treatment, but what I've seen anecdotally is a reduction in pain. It's essentially soft tissue release for the plantar fascia. Not only that, but it seems to promote blood flow and supposedly speeds up healing. 2 to 3 minutes every night before bed. I'm not going to do too much today because I'm doing the calf raises later, but yeah, there we go. So after you're done, wipe off everything. And actually, I'm someone who's struggled with plantar fasciitis for a little while, so I have been using this semi-regularly, and I find it does help. So that's just a little trick. It will feel a bit numb, it'll feel a bit weird, but the good thing is you won't be feeling that pain. So some studies indicate that it works with pain modulation, i.e. it just makes you feel something other than the pain you're getting in your heel. As we discussed earlier, fallen arches or flat feet can be a risk factor for developing plantar fasciitis. Typically, people develop this foot instability after having an ankle sprain and it not being addressed properly. This can be compounded if they've had more than one ankle sprain, so if the ankle sprains are repetitive, if you've sprained your ankle more than once and you've not seen a physio or it's not been rehabbed properly. So we have to rebuild that foot stability. Really simply, how long can you balance on your foot for? How long can you balance on one leg? What is your single leg stand like? You want to then practice it a few times daily, hold as long as you can. You'll find that at the start it'll be really difficult, your foot will wobble, you might even have to use a bit of support, but gradually you will get better. Over time your balance will improve, your foot stability will improve. The trap that a lot of people fall into is that it gets better and they stop doing this balance exercise. No, you need to continue doing this balance exercise forever. Lastly, the loading program. It's really important. I mean, this is literally the bread and butter. If you don't do anything else on this list and you do one thing, this is the one thing that will get you better over time. This is based on the Rathlet protocol, but I have simplified it. So essentially what you want to do is take a towel, roll the towel up, then place your foot or your toes on the edge of the towel so that you're putting a stretch on your plantar fascia. So you can use a towel, but for the purposes of this, I'm going to use my yoga mat. It's a little bit more comfortable than a towel. So as you can see, I've rolled it up here. Roll it up. And what you'll find is there should be a bit of stretch. Oh, there we go, perfect. Stretch under the plantar fascia, and then you can place your toe on the edge of that towel bit that's rolled. Perform a calf raise. And then you want to see how many single leg calf raises you can do without pain, or before you get fatigue. Let's say you do 6 reps and you get pain. You then want to go around 5 reps, and that is the number of reps you're going to do in a set. You're going to do 3 sets of 5 every 48 hours. Your goal is to try and slowly beat what you did every single session so that your plantar fascia has a chance to adapt, to get stronger, and to help get rid of your condition. For example, you do 5, 5, 5, and then 48 hours later you do 5, 5, 6, and then 48 hours later you do 5, 6, 6. You can either spread it out throughout the day, morning, afternoon, evening, or you can do them all in one go and rest about 2 to 3 minutes between sets. If you can't do a single leg calf raise due to pain, you can start going up on 2, coming down on 1. So this is known as an eccentric calf raise, but you want to build up to doing it on a single leg as soon as possible. Something that my patients in the clinic always ask me is, why is it taking so long to get better? And the reason for that is collagen, which makes up the plantar fascia, takes 4 months to turn over. That is 100 days. So you might not see drastic improvement in 100 days, especially if you've had the condition for a little while. It can take a while for the actual condition to resolve. You can speed it up, or if you really feel like things are going slow, or if you feel like it's not getting better, you can have something known as shockwave. Shockwave therapy is this non-invasive method which fires pulses of energy into the plantar fascia. It is not a magic pill. You still have to do the exercise program, the loading program, everything that I've talked about in the video, and the shockwave is just a catalyst that speeds things up, so you should start to see results by the 3rd or 4th session. You can Google shockwave providers near you. Usually it's a clinic or hospital. It can be a bit pricey, so if you don't need it, then you don't need it. If you can't afford it, then obviously this video is going to help you without shockwave. But normally we would only use shockwave on people who have had the plantar fasciitis for longer than 5 to 6 months. You might also choose to see a podiatrist or an orthotist, and they will take a mold of your feet in sand and create you some custom insoles which will support the arch of your foot when you're walking day to day, and you'll have to build up into wearing those for the whole day. You start with a few hours and then build up to several within the whole day. They should provide you some relief. I sincerely hope that you found the video useful. If you have, then obviously please like the video, subscribe to see more, and I'll catch you guys in the next one.
I'm on my own, broken alone. I feel the rain crashing down all around this empty town. I'm searching for the lost and found.